Good day, everyone. I am Joebert and Siman, and today I'll be discussing to you what is prescription drug abuse. What is prescription drug abuse, by the way? Prescription drug abuse is when someone takes a medication inappropriately, such as without a prescription, in a way other than as prescribed, or for the high elicited. There are three most commonly abused prescription drug abuse. These are the opioids, anti-anxiety, and the stimulant. First is opioids. Opioids is used to treat pain. Example of these medications containing oxycodone, such as OxyContin and Percocet, and those containing hydrocodone, such as Norco. Second is the anti-anxiety. Medications and sedatives such as alprazolam, example of these is the Sanas, and diazepam, example of these is the Valium, and hypnotics such as zolpidem, example of these is Ambien, used to treat anxiety and sleep disorders. Third most commonly drug abuse is the stimulants, such as methylphenidate, example of these is Ritalin, Concerta, and others. Dextroamphetamine and amphetamine, example of these is Adderall XR, Mydase, and dextroamphetamine, example of these is the Dexedrine, used to treat attention deficit or hyperactivity disorder or ADHD and certain sleep disorders. Most common signs and symptoms of the three prescription drug abuse. First is the signs and symptoms of the opiates. It includes constipation, nausea, feeling high or oporrhea, slowed breathing rate, drowsiness, confusion, poor coordination, increased dose required for pain relief, and lastly, worsening or increased sensitivity to pain with higher doses or hyperalgesia. The signs and symptoms of the anti-anxiety medications and sedatives, it includes drowsiness, confusion, unsteady walking, slurred speech, poor concentration, dizziness, problems with memory, and lastly, slowed breathing. While for the stimulants, the signs and symptoms are increased alertness, feeling high, irregular heartbeat, high blood pressure, high body temperature, reduced appetite, insomnia, agitation, anxiety, and paranoia. For the overall signs and symptoms of the three most common drug abuse, these are stealing, forging, or selling prescriptions, taking higher doses than prescribed, excessive mood swing or hostility, increased or decreased in sleep, poor decision making, appearing to be high and usually energetic or revved up or sedated, requesting earlier fills or continually losing prescriptions. So more prescriptions must be written, and lastly, seeking prescriptions from more than one doctor. These are the reasons why teens and adults abuse prescription drugs. First is to feel good or get high. Second, to relax or relieve tension. Third, to reduce appetite or increase alertness. Fourth, to experiment with the mental effects of the substance. Fifth, to maintain an addiction and prevent withdrawal. Sixth, to be accepted by peers or to be social. Seventh, to try to improve concentration and academic or work performance. Some people fear that they may become addicted to medications prescribed for medical conditions, such as painkillers prescribed after surgery. But You can reduce your risk by carefully following your doctor's instructions and how to take your medications. These are the risk factors of the pre-prescription drug abuse, which happen at any age but commonly begins in teens or young adults. These are past or present addiction to other substances, including alcohol and tobacco, family history of substance abuse problems, certain pre-existing psychiatric conditions, exposure to peer pressure or a social environment where there is drug use, easier access to prescription drugs such as having prescription medications in the home medicine cabinet, lack of knowledge about prescription drugs and their potential harm. Prescription drug abuse may occur in people who need painkillers, sedatives, or stimulants to treat a medical condition. If you are taking a commonly abused drug, here are ways to reduce your risk. These are the prevention. First is make sure you're getting the right medication. Make sure your doctor clearly understands your condition and the signs and symptoms. Tell your doctor about all your prescription as well as over-the-counter medications, herbs and supplements, and alcohol and other drug use. Ask your doctor whether there is an alternative medication with ingredients that have less potential for addiction. Second, check in with your doctor. Talk with your doctor on a regular basis to make sure that the medication you're taking is working and you're taking the right dose. Third, follow directions carefully. Use your medication the way it was prescribed. Don't stop or change the dose of a drug on your own if it doesn't seem to be working without talking to your doctor. For example, if you're taking a pain medication that isn't adequately controlling your pain, don't take more. Fourth, know what your medication dose. Ask your doctor or pharmacist about the effects of your medication so you know what to expect. Also, check if other drugs, over-the-counter products, or alcohol should be avoided when taking these medications. Fifth, never use another person's prescription. Everyone is different. Even if you have a similar medical condition, it may not be the right medication or dose for you. Lastly, don't order prescriptions online unless they're from a trustworthy pharmacy. Some websites sell counterfeit prescription and non-prescription drugs that could be dangerous. Prescription drugs are commonly misused substances by young people. Follow these steps to help prevent your teen from abusing prescription medications. First is discuss the dangers. Emphasize to your teen that just because drugs are prescribed by a doctor doesn't make them safe, especially if they were prescribed to someone else or if your child is already taking other prescription medications. Second, set rules. Let your teen know that it's not okay to share medication with others or to take drugs prescribed for others. Emphasize the importance of taking the prescribed dose and talking with the doctor before making changes. Third, discuss the dangers of alcohol use. Using alcohol with medication can increase the risk of accidental overdose. Fourth, keep your prescription drugs safe. Keep track of drug quantities and keep them in a locked medicine cabinet. Fifth, make sure your child isn't ordering drugs online. Some websites sell counterfeit and dangerous drugs that may not require a prescription. Lastly, properly dispose of medication. Doesn't leave unused or expired drugs around. Check the label or patient information guide for disposal instruction or ask your pharmacist for advice on disposal. Just remember that prevention is better than cure. Remember, safety first. And according to Naval Ravikant, a fit body, a calm mind, a house full of love, these things cannot be bought, they must be earned. Thank you and have a nice day.